Bonjour. Merci beaucoup pour accepter notre invitation. Thank you very much for coming here in such great numbers. Before I get started, it's a great pleasure that I'd like to acknowledge the presence of Deborah Brown, who is the president of EMD Toronto, and more importantly, the chair of RxND. Deborah, thank you for being here. When I get it with groups like this, and I think about the challenge of trying to explain the work we do in the research-based pharmaceutical industry, sometimes it seems like we're advocates for accountancy. If we're not careful, our message comes across complicated and boring. Or we appear often, and sometimes we've done this, defensive because we are trying to explain ourselves. But in truth, I find that our work and mission uplifting and inspiring. I feel privileged as president of RxND to be part of an industry that is engaged in re-engineering a sector that is so crucial, so vital to the future of our country, and at a time that there's so much enormous change going on. And also where the outcome, if we do our work right, will give benefits for Canadians for future generations to come. So for a challenge that matters, for a chance to make a difference, we talked about politics, but it doesn't get better than this. My friends, our country is defined as a nation that got the fundamentals of healthcare right. It's part of our identity, but it is at risk today. More than ever, our healthcare system is facing major challenges. Delivering healthcare, quality healthcare today, is increasingly a partnership of effective medicines, improved care, and leading-edge technologies. It's a partnership of all of those. Our members continue to invest billions in the work, while with exciting results. The innovations have helped lower treatments, reduce hospitalizations, and most importantly, have saved lives. Sadly, this success is often drowned out by the noise of conflict in our sector. For too long, our industry, along with many players in the healthcare sector, have been entangled in our own squabbles, in debates that on the surface seem quite meaningless to the Canadians that depend on us. And there are many examples, whether it's doctors versus nurses, whether it's hospitals versus community and home care. But no place is there more truth to that than in the pharmaceutical sector, where the brand generic banter is legendary. In truth, though, health system sustainability will only be achieved when we all work together and add value. There is clearly a role for both generics and brand in the sustainability of our healthcare systems. Les Canadiens sont tannés des gros titres des journaux. Ils attendent les réponses de toutes ceux et celles qui sont les leaders dans le domaine du secteur de santé. Et ils veulent avoir les réponses le plus tôt possible. They don't want to hear why my sector deserves more money than your sector. They want better health outcomes. They are tired, frankly, of battles over pricing, funding, and accountability. Not unreasonably, Canadians say, we elect governments to deliver better high-quality health care with better value for money. And they tell us, the pharmaceutical community, as well as all private sectors involved in healthcare, to help them do this. Canadians want to know who is going to provide the innovation, the value for money, and the better health outcomes. They want to see more collaboration, effective partnerships, and a commitment to change and reform. Canada's research pharmaceutical community is determined to be a leader in this effort. We see a way forward only when all the interests work together to maximize the value for Canadians. And our industry has come a long way. We talked about the days when it was called PMAC. It's come a long way. We now work closely in partnerships governed by a detailed codes of conduct with Canada's leading medical schools, research institutions, health charities. Nous travaillons en partenariat avec tous les gouvernements, les hôpitaux, les universités, les agences de santé publique partout le Canada. And we have made up as a priority to develop strong partnerships with provincial governments, We've approached them saying, give us a problem, and we want to help you solve it together. Take, for example, a project in Prince Edward Island where the Harborside Family Health Center, the PEI Lunch Association, the government of PEI, and 3 RxND member companies have come together with one goal in mind: to improve the quality, access, and efficiency of care for people living with COPD. And as you know, that's a very serious lung disease. The project demonstrates that national, provincial, and local organizations, private and public, can work together around a common cause and each making valuable contributions. And the preliminary results of this kind of partnership are outstanding. 50% decrease in ER visits, 50%. 30% decrease in return ER visits, and on the average, a day per patient reduction in hospital stay. All because people living with COPD in PEI are receiving the right care at the right time in the right setting. Now that's success by any measure. And it's so important for PEI, it is now expanding to other regions in the province. I could tell you similar value demonstrating projects in development are underway across the country, and particularly in Quebec and Ontario. We have made a good start in this field of partnerships, but it's up to us that this collaboration has to go from this level to a higher level if we're going to achieve the goals that we want. Today, the challenges facing the healthcare sector are colliding with the fiscal pressure driving every finance minister's decisions for today, tomorrow, and for years to come. As an industry, the research-based pharmaceutical industry, we could easily just look at our own piece of the puzzle. And then independent research shows that drug costs are not the major driver of health cost inflation. In fact, the PMPRB shows that they are on the decline. But frankly, nothing works in isolation. We need to consider the full picture altogether. The broader healthcare budget continues to climb, and if we do not do all of our effort to bend that cost curve down, we can't get that value curve to go up, and access to innovation will be challenged. And that clearly isn't in the best interest of Canadians. Now let me tell you a story about one Canadian I've had the privilege to talk to, Tanis Charles, who was diagnosed with rheumatoid arthritis shortly after the birth of her son. What began as sore wrists rapidly took over her body. And as a young woman with young children, she found herself in constant pain, facing possible life in a wheelchair, living with a disability. She described it as zero range of motion. She could not get herself out of bed or into a shower. She had run out of treatment options, nothing had worked, and she was seriously depressed. But in 2006, Tanis's doctor recommended she participate in a clinical trial in Canada, the first in the world, to test a new biological medication. It was a decision that changed her life. Today, Tanis is in remission. She enjoys her full-time job and is a fully engaged parent. She says she can ride a bike, walk all day long, and then walk all day long tomorrow. She has her life back. She calls her biologic medication a miracle. I talked to Tanis on the weekend, and she's fully engaged in life. She just finished hula hooping. She was walking up 14 flights of stairs a day, challenging her other colleagues to do the same, embracing life. It was people like Tanis inspire me. Stories that like Tanis inspire me. Perhaps you know somebody just like Tanis. Or perhaps you are somebody like Tanis. Making miracles work is important. It's only because science is pushing us in exciting new directions. And just in time, because Canadians are getting older. Some of us are getting older faster than others. But clearly, Canadians are getting older. Les Canadiens sont en train de vieillir, et plus que nous sommes âgés, plus que nous avons besoin des traitements, plus que nous avons besoin de temps dans le système de santé, plus de soins. Et pour la première fois dans l'histoire du Canada, le Canada comptera plus des personnes âgées que les jeunes moins de 15 ans. First time in Canadian history, there'll be more senior citizens than people under the age of 15. The pressure is real, and some of the best minds of government, academia, and university are working hard on innovations that improve treatment, increase value, and contain costs. But there is one big, urgent task we must accomplish, and we'd like Canadians to get behind it. It's complicated, and it's not easy to put on a bumper sticker, but it's essential to our industry in Canada and to continued innovation in Canadian healthcare. So if you could bear with me for a few minutes, I will explain it. As Hugh talked about, 25 years ago, with considerable political courage, I forgot the 11 days of the bell ringing, but considerable political courage, Ottawa began to dramatically overhaul protection for health innovators and their products. The reform of intellectual property safeguards distinguished Canadians and Canada as an environment for investment, and it sparked a boom in research in our industry. It took Canada from close to the bottom to the top tier of life science research. And in that way, we created thousands of high-quality valued jobs that work directly in our industry, and thousands more in manufacturing and supporting jobs. Mais le monde a tellement changé depuis les années 80. Les coûts en recherche pour chaque médicament développé en succès n'ont jamais été aussi élevés. Le cycle de développement de la conception et à nouvelles thérapies prouvées efficaces n'est jamais aussi long. And at the same time, many nations across the globe have strengthened their support for innovation through further patent reform and along with streamlined regulatory and research incentive systems. Just as in 1986, Canada has fallen behind. And today, just as we had to do then, Canada has to take bold steps to catch up and give our ability to win those competitions, to bring those research dollars to Canada.